Today I will going to talk about otitis externa. Otitis externa is an inflammation or infection of the external auditory canal, the auricle or both. There are different types of otitis externa. From this, the most common form is acute diffuse otitis externa. This is typically seen in swimmers, and the duration is less than 6 weeks in acute diffuse otitis externa. The other is acute localized otitis externa, which is also called furunculosis. This is associated with infection of hair follicle, and it's more confined than that of acute diffuse otitis externa. Chronic otitis externa is the same as acute diffuse otitis externa, but the duration is longer than 6 weeks. Exanthematous otitis externa is when there is some dermatologic conditions that predispose for otitis externa, such as atopic dermatitis, psoriasis, and the others. Necrotizing or malignant otitis externa is infection that extends into the deeper tissue adjacent to the external auditory canal. And otomycosis is infection of the ear canal from a fungal species. There are different risk factors to have otitis externa. The first is excessive wetness from swimming, bathing, or increased environmental humidity. And also excessive dryness can predispose for otitis externa. Dry canal skin and the lack of cerumen is another risk factor. The presence of other skin pathologic conditions, such as previous infection, eczema, or other forms of dermatitis, predispose for otitis externa. Trauma is also another risk factor, which may be due to digital or foreign body, which makes the skin of the canal vulnerable to infection. External otitis or swimmer's yeast is caused most commonly by Pseudomonas aeruginosa and S. aureus, which is responsible for up to 90% of cases. But there are also other bacterial etiology that causes otitis externa. Regarding clinical manifestation, the predominant symptom is acute rapid onset, typically within 48 hours of ear pain or otalgia, often severe, accentuated by manipulation of pinna or by pressure on the tragus and by jaw motion. Itching, conductive hearing loss, which may result from edema of the skin and the tympanic membrane, and serous or purulent secretions, canal skin thickening associated with chronic external otitis, and edema of the ear canal, erythema, and the thick, clumpy otori are predominant sign of acute disease. The cerumen usually is white and soft in consistency, as opposed to its usual yellow color and the firmer consistency. And the canal often is so tender and swollen that the entire ear canal and tympanic membrane cannot be adequately visualized. If the tympanic membrane can be visualized, it may appear either normal or opaque. Other physical findings may include palpable and tender lymph nodes in the periauricular region, and the erythema and the swelling of the pinna and the periauricular skin. Rarely, facial paralysis, other cranial nerve abnormalities, vertigo, and the sensorineural hearing loss are present. If this occurs, necrotizing or malignant otitis externa and an invasive infection of the temporal bone and the skull base is probable. When we see diagnostic criteria for acute otitis externa, to diagnose acute otitis externa, we should have to have one of the following symptoms: otalgia or ear pain, discharge from the ear and the itchiness, in the presence of any of the two of the following signs: tragal tenderness, ear canal edema, ear canal erythema, and wet debris. To say it is acute, it should last for less than 6 weeks from the onset of symptoms, whether treated or untreated. The primary treatment of otitis externa is management of pain, cleaning the external auditory canal, topical antibiotics and steroids, and also IV antibiotics may be needed for individuals at risk for necrotizing otitis externa. Most cases can be treated with analgesics and topical ear drops, and the surgical debridement is rarely indicated. Necrotizing or malignant otitis externa is a potential lethal infection of external auditory canal and the surrounding structure, and Pseudomonas aeruginosa is the usual culprit. Risk factor for necrotizing otitis externa is immunocompromised states such as diabetes mellitus, elderly, retroviral infection, and it's typically seen diabetes and immunocompromised in patients. Thank you for watching.